Hello, this is Dr. Raj Singh. I practice at Healer and 7 Heart Medical Spa in Las Vegas. I treat a lot of patients with acne, so thought of making a video about it. So today's video is about acne, why we get them, how can we effectively manage them, what are some of its complications, and how to effectively treat the complications and the underlying disease. So let's get started. So when it comes to acne, there are just so many misunderstandings and myths around this disease. Acne are contagious. They are not. You can't give it to another person. Acne only happen in teenagers. It's not true. I mean, I see patients from all age groups affected by acne. Acne can be cured. It's not true. Acne are treatable, but unfortunately they're not curable. Acne do not have any long-term complications. That's not true. It's not a pimple. It can cause significant skin scarring. It can cause emotional problems. Can reduce job and promotion prospects. So acne should be treated effectively, okay, and aggressively. What are some of the causes of acne? So of course, changes in hormones, elevated levels of testosterone, progesterone. Sometimes if it's too low, can cause acne flares. That's why we see them more during menstrual cycle. Of course, polycystic ovary disease. If you use a cream that is too greasy, blocks the pores and ducts, that can affect it. Excessive humid environment. Certain foods or supplements that raise testosterone levels, for example, ashwangantha or boron. Then there's the excessive overgrowth of the bacteria called P. acne. Genetics also play a role. So let's take a look at different type of acne pimples. So in this picture, you can see a healthy sebaceous gland at the base of the hair follicle. This sebaceous gland is producing sebum, which drains into the skin through a duct often called as pores. Now sometimes these pores get blocked with dead skin cells, other debris, and causes bacterial infection. Now because the pores are still sealed from the air, the sebum inside remains white, and we call them whiteheads or a closed comedone. Over time, as excessive pressure builds up in these glands, these pores open up. The sebum is exposed to air, which turns it black, and we call them blackheads or open comedones. Now white cells may attack these, can cause an infection, produce pus, and then these papules, they become what we call pustules. So in this picture, you can see a healthy sebaceous gland. Once the ducts get blocked, that's when we experience the initial symptom of acne. Over time, there is more buildup. You will see protrusion of the skin, and the pimple is forming. Especially important is the presence of this bacteria called P. acne, which I mentioned before, which causes a lot of inflammation and infection. So eventually, as the skin repairs itself, we form scars at these sites. Now this scar tissue could have pigmentation, and over time, as the skin contracts, we see these depressions in the skin. These depressions, they absorb light when it falls on our skin, and skin appears to look unhealthy and dark. A lot of dark spots, that's from acne scarring. Now we all have sebaceous glands in our skin. However, in patients with acne, these glands are larger in number. They unfortunately produce more sebum, and the skin also has a large number of P. acne bacteria. So it's a perfect storm. Now there are several types of acne scars. As you can see in this picture, they're named based on their appearance. So you could have, ice pick scars, deep scars, so there's box scars, there's so many. So now let's talk about how to manage acne. What can you do at home? So home skincare regimen is just as important as getting treatment in our medical spa, for example, to prevent acne breakouts. So you got to keep it simple. So use a gentle cleanser in the morning and before bedtime to remove the dirt, the dead skin cells, all the debris and makeup. So this will keep the ducts open and it'll reduce the chances of flare-ups. Use a gentle toner, such as witch hazel works really well. Avoid alcohol-based astringents. They tend to have too much of a drying effect, and dry skin is not a healthy skin. Of course, exfoliate at home to remove that skin cells, that dead skin cells that are clogging pores. Exfoliate every single day if you have oily skins. 2 to 3 times a day, a week if you have a normal skin, and only once a week if you have very dry and sensitive skin. I do not advise, mechanical exfoliation, as it's too harsh. So generally salicylic acid or glycolic acid exfoliators work really well. Of course, protect the skin by using a good moisturizer and sunscreen, especially mineral-based sunscreen, based with zinc or titanium is so important. Now, if you have moderate to severe acne, you will need some professional care. So these are some of the things that I use in my medical spa. So of course, topical or oral antibiotics, a patient has a really bad infection. All skin treatments, they must wait till the infection is cleared. Hormone blockers such as spironolactone or aldactone. I generally do not prescribe oral contraceptives for acne because of significant side effect profile. Occasionally we'll prescribe retinoids, but they cause significant dryness and skin sensitivity, so we're reserved for very severe acne. Now, deep facials, they're very effective at keeping acne under control. We also use, blue light therapy. It's very helpful. What blue light does, it works by killing the P. acne bacteria. So it reduces the inflammation, reduces the swelling in the skin. So you can see a patient of ours getting a blue light treatment. Dermabrasion to remove dead carotenoid, dead skin cells, that helps. Microneedling. You can do microneedling with platelet-rich plasma or stem cells. All right, so let's look at acne complications. So acne can cause significant scarring and they can cause pigmentation issues. So these need professional care. There's so many effective treatments, such as microneedling, I mentioned that before, platelet-rich plasma. We sometimes will use hydroquinone-based treatments. They are very effective for hyperpigmentation. However, hydroquinone is an irritant and actually can cause more pigmentation if not used properly. Now, the skin is our largest organ. And I've seen many people just focus on the skin without fixing the underlying medical problem that are actually causing acne. So I believe in focusing on overall health, correcting nutrition, fixing hormone problems, and sleep. In order to get the best results and prevent long-term complications, seek medical help early. The longer we wait, the poor results we get. So I hope that was helpful. Acne are common, they're not curable. However, there are many effective treatments available to prevent acne breakouts, prevent complications of acne such as scarring and hyperpigmentation. Follow a good home skincare regimen and seek help early. So that's all for today. Thank you so much for watching. I will see you back in a few weeks. Bye-bye.